What does it mean if your breast cancer has lymphovascular invasion? It sounds really scary, doesn't it? Like your breast cancer is about to spread at any point. My breast cancer had it too, and I was really worried. Today, I'm going to put your mind at ease. I'll tell you what it is and what it means. I'm Dr. Liz O'Riordan. I'm a breast surgeon who's had breast cancer, and I do the research so you don't have to. So, what is lymphovascular invasion? Well, it's a term used by pathologists when they look at your breast cancer under the microscope to describe what they see. After the surgery, your pathologist takes very thin slices of your cancer and the surrounding breast tissue and looks at it. If cancer cells are seen in the blood or lymph vessels near the breast cancer, then there is lymphovascular invasion. It does not mean that you have metastatic or stage 4 disease now, and having lymphovascular invasion does not mean that you are automatically going to get stage 4 disease in the future. Before I tell you what it does mean, I first want to talk about how does breast cancer spread. Your breast has two different networks of tubes that carry fluid to and from it. The first is the vascular system, so the arteries and veins that carry blood around the breast. And the second is the lymph system. And that's part of your immune system, which drains a watery fluid called lymph from the breast to the lymph nodes in your armpit. Breast cancer cells have the ability to invade, which means they can leave the tumour in your breast and enter the blood or lymph system to move around the body. Some cells won't move very far at all and they will stay in the breast tissue. Some will travel to the lymph nodes in the armpit to set up camp, which is why we always check your lymph nodes to see if this has happened. And the majority of women, over 70% of you, won't get a recurrence. Breast cancer cells are removed at surgery or destroyed with radiotherapy, chemo, or other drugs like tamoxifen and Herceptin. But for a small number of women, breast cancer cells can bypass or travel through the lymph nodes and end up in your bones and organs where they can start growing, even 30 years in the future. So what does lymphovascular invasion mean for you? Although it's scary to hear that there are breast cancer cells already in the blood and lymph vessels by your cancer, and it's easy to put 2 and 2 together and make 7, it's not that big a deal. Your doctors don't use it to work out your prognosis, and that means it doesn't have a big impact on whether your cancer will come back in the future, and we don't use it to help us decide whether to give you extra treatments like chemotherapy. In order for your breast cancer to reach the lymph nodes in your armpits, the cells have to travel through the lymph vessels in the breast, meaning there will be lymphovascular invasion. But for some of us, the cells have only just started to leave the breast. For others, like me, they've made it to the lymph nodes in our armpit, and that's why we use involved lymph nodes, not lymphovascular invasion, to help work out your prognosis. There isn't a lot of research on it at the moment, but this is what we know so far. It's more common in younger patients, it's more common in ductal breast cancer, it's more common in ER-negative, HER2-positive tumours, and it's more common in large, high-grade, node-positive cancers. And because of that, it's associated with an increased risk of local and distant recurrence. But that makes sense, because recurrence is more common if your cancer is big, it's high grade and your nodes are involved. And that's why we give women with those cancers extra treatments like chemotherapy, hormonal and targeted therapy to try and stop it spreading. There isn't enough data to show whether lymphovascular invasion is a useful thing to include when working out your breast cancer prognosis. And I could tell you not to worry too much if your cancer has it, but as I said before, I was really anxious when I found out mine did, and it's natural to worry. So instead, I want to remind you that we treat every breast cancer to reduce the chance of it coming back in the future, and that people who don't have lymphovascular invasion could still get stage 4 disease. There is still so much we don't know about why breast cancer happens and why it spreads. All you can do to reduce your risk of recurrence is keep taking the tablets if you're on them, exercise, eat a healthy, balanced diet, and cut back on alcohol. If you thought this was helpful, remember to subscribe so you don't miss my next video. I'm Dr. Liz O'Riordan, and thanks for watching my channel.